Welcome to the program. I'm your host, Neal Howard. Glad that you're here with us. You know, we all deal with some relationship challenges, but folks who are dealing with a chronic condition, say osteoarthritis or rheumatoid arthritis, can find relationship and intimacy issues especially challenging. Our guest is Dr. Logan Levkoff. She's a relationship expert. She's joining us to talk about tips and insights that have to do with maintaining intimacy and a healthy relationship while you're dealing with a chronic condition. Welcome to Health Professional Radio, Dr. Logan Levkoff.
Thank you very much.
Give us a brief background about yourself, and let's talk about some of these intimacy and relationship challenges that folks suffering with chronic diseases often face.
Sure. So I am a sexuality and relationship expert. I have a master's and PhD in human sexuality, marriage, and family life education. So I like to say that I get to deal with the everyday issues of intimacy and relationships. So I'm not a medical professional, but I get to deal with the issues that we all face on a regular basis. And I was asked to contribute to arthritis.com to create a space to talk about the challenges and opportunities that people who are dealing with a chronic illness face when it comes to sexuality and relationship. There are certain challenges that people with RA in particular face simply because intimacy and sexual function and self-esteem are all impacted by pain and other symptoms that have to do with RA.
What are some specific challenges above and beyond the pain that somebody might deal with RA?
The reality is that RA comes beyond pain with, dryness in the body, swelling joints, self-esteem issues that can potentially create negative body image, incredible fatigue, and all of those things when you're navigating a relationship, especially a new relationship, means that we have to develop a language for talking to partners. And perhaps what's most challenging is that not every partner is going to understand what that means for us and how our threshold for certain things may change over time.
So basically, it's communicating problems that you have in addition to those needs that you would have on a normal level dealing with intimacy.
Definitely. Communication is essential no matter what. It's certainly not a novel idea, but it's one that we always talk about because it's essential to any good relationship. But it's particularly important when we talk about someone having RA, because the reality is that unless you're in someone's shoes and body, you really don't know what that other person is experiencing. And you don't necessarily know the difference between discomfort, pain, and, I'm not in the mood versus I am so incredibly fatigued I can't even consider anything sexual or intimate at the moment. And that means we have to not only communicate clearly what our needs are, but also to really define what certain words mean when we say them, because often we apply our own definitions to what we hear people saying, and that can be problematic for everything.
Now, as a relationship expert, how often do you find yourself talking to people that went on that date, they got over body image issues, but halfway in or maybe second date, they're having issues? Should they just blurt out what's going on with them, or is there a delicate approach? How do you start the conversation when you start to have those second thoughts?
That's a great question. And I really don't believe that there are any rules to how and when or how soon we share information about whatever chronic illness or condition that we're dealing with. There are some people who are really comfortable being upfront right from the start, and others who feel like they really need to develop some trust and intimacy with someone before they disclose that much information. So I don't really think there's a when. I would say that if you find that this is a relationship that's worth pursuing, that there's something potentially deeper there, then RA or any other condition is part of the story that we tell. It's part of what makes us who we are. So we should feel comfortable at some point sharing it, but it may not be at the beginning, and that's really okay. Someone has to earn our trust. We don't necessarily just have to share it all right from the beginning.
How much do some of the medications, creams, or maybe even some of the remedies that are less looked upon as credible have to do with some of these issues when it comes to intimacy? And, you might be taking pain meds or something like that, and everything's okay. But on those days when you're not on meds or doing certain exercises, there might be a lull in the action, as it were, and maybe your partner won't understand. Why didn't you say something, when you were on the meds that this could potentially happen? Is there a situation that you find people concealing certain conditions?
I think that oftentimes when we have a chronic condition or illness, we don't always want to burden our partners with all of the information, and we wind up suffering in silence. And if physically on the outside no one can see that we're struggling, that kind of creates this intimacy gap between people because we're not being totally authentic. We're not sharing our story in our entirety because we want to seem stronger and tougher, and that's okay, but it is part of our story. And what happens is if we don't share, especially with a partner and especially one that we care about, we wind up, creating a situation where someone really can't read us. And, in any situation, that's really not good because we wind up speaking two totally different languages.
There are people who, I guess, the next closest person that they deal with on a regular basis would be their physician, their healthcare provider. Maybe they go to them for some advice before they break the ice with a partner or a potential partner. How can a healthcare professional who may be specializing in one thing or another help out a patient who needs something that may not be totally related to the pain?
Well, I can certainly tackle it from the patient perspective. I would say that as patients, I think that we have every right to talk to our medical professionals about sexual function, about intimacy, about desire, about the things that impact those aspects of our lives, because that is a part of our overall health. And what happens is if we don't share those things and ask questions, then we wind up suffering in silence when we don't have to. So I understand that having those conversations with medical professionals can be really challenging, but we do have the ability to do so as patients and create a meaningful dialogue. I really believe that if we want our partnerships to be meaningful and fulfilling and equitable, and equitable doesn't mean that everyone is giving exactly the same amount all the time. It means that there is a balance and we contribute differently to relationships. But there is never a reason to keep something, especially something so critical to who we are as a person, from the partner if we really do care about this relationship. If you don't care about the person, then feel free. Don't share anything at all. But the reality is that as we age, as our conditions progress, as our partnerships develop, life throws us lots of curveballs. And if we're not honest about them, then we just create a lot of distrust in a relationship. And if we want intimacy and closeness and connection, we can't be hiding those aspects of who we are.
Well, where can our listeners go and learn some more about RA and how it affects intimacy and relationships?
Your listeners can go to arthritis.com. I have been very fortunate to have the ability to write lots of articles for all things relating to sexuality and intimacy for people dealing with RA, and there are a lot of patient stories as well, so feel free to direct people to arthritis.com.
Dr. Logan Levkoff, thank you so much for joining us today on Health Professional Radio.
My pleasure. Thanks so much.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at healthprofessionalradio.com.au.